All right. So, hi, good evening, everyone. I hope you all can hear me well. You all can see me well. So, I'll just wait for a while so that people can join in. And then we will start. All right. So, hi, good evening, everyone. I hope you all can hear me well. We will be discussing the certain MCQs. Of orthopedics, and these orthopedic MCQs are going to be helpful for you for all your exams, right? So you all can, yeah, I can see the chat section now. All right. So good evening, Prashant. Good evening, Kashif. Good evening, Ames, Yogita, Niti. Hi. Good evening, everyone. So I have got certain MCQs for you, and I want to discuss that with you, right? So I hope we are ready to start. Let's start with this. Okay. So let's start. I'll just share my screen, and I've got some MCQs to be shown to all of you. Let me just see uh, how many of you can answer these questions correctly and rightly. चलो शुरू करते हैं. So yeah. So I have these questions for all of you. Tell me the answers in the comment box, whatever you can. Try your best. Okay. So all right. Okay. So शुरू करें everyone. Right? Orthopedics will not be that tough. I know you all can easily answer them very, very nicely. Right? Chalo, first question you have is this one. A patient involved in RTA arrives at emergency department with multiple injuries, including a fracture femur and significant blood loss. Right? There is a fracture of the femur bone and there is a lot of blood loss. Which of the following option is not the part of initial management of this patient? Right? So we have certain keywords here. RTA, emergency, multiple injuries, right? Not just one fracture, multiple injuries. So fracture femur is there, blood loss is significant. Fracture femur, you all know, in the when you're talking about the fracture of the femur bone, that how much is the approximate amount of blood loss expected in the femur shaft fractures? How much is the amount of this blood loss expected? It is almost 1 to 1.5 liters, isn't it? 1 to 1.5 liters. That is a minimal amount of blood loss which is expected, right? So we are talking about broadly a polytrauma case which, lost a lot of blood. So which of the following is not a part of the initial management? IV crystalloids, fluids, yes. Trenexa, bleed control, coagulation profile definitely need to be checked, but internal fixation of the femur bone, right? That is not definitely required, right? So what we can do is right now we can only go for an external stabilization or external fixator rather than going for internal fixation. Very, very good, right? So always remember when it comes to your exams, and whenever you're talking about a case of polytrauma, right, always remember the management of polytrauma has to be learned in lines with ATLS guidelines, right? You all remember that ATLS guidelines. And in ATLS guidelines, what are the steps to be followed? It is A, B, C, D, like that, right? A, B, C, D, E. So airway to be given the priority. Now understand, if the same question would have been there, right? Same question would have been there, but instead of this option B, we have the airway management, right? And they're asking you, what is the first step in the management? What is the first step in the management? They just change it like this, and they're asking you, what is the first step in management? Then what is your answer? So first step is not fluid. First step is not coagulation profile. First step is not fixation. First step has to be what? Airway management, right? That is how sometimes they are going to trick you up in your exams as well. Okay. They will trick you up somewhere in exams, something like this only. So always remember how we have to answer depending upon the scenario given to you, right? Never ever get trapped in this. All right. I have damage control orthopedics. Very good. Okay. So polytrauma guidelines, ATLS guidelines, they have to be followed all the time, right? Airway management is the most important one for sure, right? Airway management is definitely, just a moment. Yeah. So airway management is definitely one of the most important thing to be done in all your patients. All right. Absolutely right. Okay. So chalo, next one. Interesting one. An old individual experienced a fall in the bathroom. and suffered a trauma, right? So older individual, they are saying age is not yet given to you, suffered trauma to the left hip, okay? Based on the radiographic finding provided over here, what position or alignment is the affected limb most likely to exhibit, right? What do you say? What do you say? Cervical spine is always after airway, beta. Medico Sohail Khan, right? Always the cervical spine is not prior to airway. Airway is always the first priority. Okay. So what are we dealing with here? Is a fracture neck of the femur, right? In fracture neck of femur, what is expected? In fracture neck of femur, shortened and abducted. Abducted is never a case here, right? Abduction is seen when there is an intertrochanteric fracture or subtrochanteric fracture, right? Lengthening and internal rotation, this doesn't usually match, right? If it is lengthening means abduction deformity. Abduction with internal rotation doesn't match any of the trauma situation, right? Shortened and externally rotated. Shortened because it is being pulled up, and it is externally rotated because there are abductors and external rotator working on this GT region, right? And flexed, adduct and internal rotation. Flexion, adduction, interrotation. It is usually related to what kind of dislocation? Can you make out? It is usually related to what kind of dislocation? If you can make out adduction and interrotation, that will be usually the posterior dislocation, right? So fracture neck femur or IT fractures, they usually have shortening with external rotations, right? Neck of femur, it is shortened and externally rotated, right? This is the abductor and the external rotator mechanism over here, right? That is, see, one of the questions I remember in our class as well, in my certain discussions as well, they often, ask you if there is a fracture over here, let's suppose shaft of femur, tell me the answer for this question. If there is a fracture of the shaft of femur over here, and what will be the direction of displacement of the distal fragment? This is your distal fragment, this is proximal fragment. Can you tell me this? If there is a fracture over here, let's suppose this is a fracture, and this is the proximal part, this is a distal part, how will the distal part be displaced? Will it be going in adduction or will it be going in abduction? Can you mention that? If there is a fracture over here, let's say this is a fracture over here, this is proximal part, this is distal part, in which direction will the distal part go? Will it be adducted or will it be abducted? Will it be adducted or will it be abducted? What do you say? Adduction or abduction? Right? Medial, that is adducted. So basically, these are the adductors coming from distal part to the inferior pubic rami. Not abduction, beta. Abduction में proximal जाएगा because abductors यहाँ है. देखो anatomy. This is all abduction. Proximal part goes in abduction. This will go into abduction, but distal part will go into adduction. Don't forget this. This is basic anatomy, right? Adduction, Naksha is right. Ames E3D is right, right? बाकी ऊपर सब ने abduction लिखा है. Abduction नहीं होगा. Are you all clear with this? These are adductors of the hip. These are adductors of the hip. So adductors, they go to the lower part of the shaft. That is why it goes into adduction. Upper part goes into abduction. I hope it is clear to everyone. There should be no confusion at all here, right? This is all based on anatomy and the muscles attached. All right. Adduction. Very good. Preeti abduction, nahi adduction. Kashyap is right. Okay. I hope this confusion is not there anymore. No mistakes here. No mistakes here. All right. 26. Okay, so 26-year-old individual fell from the first floor of a building and sustained trauma. CT scan of the lumbosacral spine is over here. Based on the imaging, what is the most likely diagnosis? क्या लग रहा है? Why externally rotated? Which one you are talking about? Abductors, external rotators है ना ऊपर? Gluteus medius, gluteus minimus, right? Gluteus muscles are there, no? Medius and minimus, right? Okay, ये कौन सा है? Is this a disc prolapse? Not really. Oh. It is a disc prolapse, not really. Is this a chance fracture? Chance नहीं है ये. Chance कैसा होता है? In the chance fracture, if this is a normal vertebra, then in the chance fracture, the vertebral body is like this. And then there is a perforating line which goes like this. So a flexion and distraction, that is chance, right? It is chance. So it is a compression fracture. No, compression fracture would be like this, a normal vertebra. This is compression and this is also compression, right? Concentric compression or wedge compression. What kind of fracture is this? This is your burst fracture of the vertebra, right? That is worst fracture of the vertebra, the burst one. This is chance, right? Chance fracture क्या होता है? Chance fracture is flexion distraction injury. Chance fracture is flexion distraction injury, right? It is flexion distraction injury. That is chance fracture. Very good. Seat belt injury. Very nice. This is called as the seat belt injury. Okay. That is seat belt injury. Very good. Okay. So chance fracture has been the question of your INSET exam in the previous sessions. You should not miss it. Okay. So कभी भी chance fracture में, compression fracture में, burst fracture में confuse नहीं होना है. Chance is a flexion along with distraction, right? So distraction will be over here like this. This is compression fracture. This one is called concentric compression. This is called wedge compression. जब vertebra पूरी compress हो जाए, that is concentric. When it is only getting a compression on one side, it is wedge, right? It is wedge. Whiplash नहीं है बेटा ये. This is not whiplash. Whiplash is a sprained neck, injury into the neck when somebody is driving very fast, right? Hyperextension followed by sudden flexion like this. That is whiplash. Okay. Chalo, next one. A 20-year-old athletic male arrives following RTA. X-ray shows the injury he sustained. What should be the next step? क्या करोगे इसमें? Here we can see again a fracture neck of the femur. And fracture neck of the femur is of what type? कैसा fracture है ये? What kind of fracture is this? Neck of femur is of how many types? Neck of femur can be just below the head. So what do you call this? What kind of fracture is this? Can you tell me? This is which kind of fracture over here? So this is basically a C. Internal fixation तो करोगे. Fracture तो बताओ कौन से type का है ये? This is subcapital, right? This is subcapital fracture. IT intra-articular. Oh, come on, बाबा. कहाँ है intra-articular? Intra-articular का मतलब तो यहाँ आना चाहिए. This is the acetabulum. This is the head of the femur. Joint में तो कुछ है ही नहीं. This is not intra-articular, right? Extracapsular नहीं. It is not extracapsular. ये आपके head के just नीचे है. So just below the head is what kind of injury? It is subcapital. And subcapital, is it extracapsular or intracapsular? Subcapital is extracapsular or intracapsular. Medico, Suhail is right. Shubham is right. So it is intracapsular, right? So age क्या है हमारे patient की? 20, right? So arthroplasty, total hip replacement ये कब करते हैं हम? When the age is more than how much? 65 years, right? When the age of patient is more than 65 years, right? And if it is less than 20, then we have to go for fixation only, right? External fixation is not even a choice. External fixation is only done. It is intra, yes. Acetabular fracture कहाँ है बेटा शुभम? It is not acetabulum, it is neck femur only, right? So internal fixation, कौन सा implant use करोगे? What you are going to do? What you are going to do? क्या करना चाहिए इसमें हमें? Internal fixation by what implant? Tell me the implant to be used. क्या करोगे? If it is subcapital, it is intracapsular. What implant are you going to use? Tell me, suggest me. What implant are you going to use? No, what implant you are going to use? Can you tell me that? When external तो करते ही नहीं है. It is cancellous. External तभी करते हैं. External fixation of neck femur is not done, right? That is not even an option over here. So it is cancellous screws. So these are cannulated cancellous screws. And how? What is the method? DHS? No. They are no. DHS is never used. DHS is used in extracapsular, basic cervical fractures, right? So this method of fixation has to be close reduction and internal fixation. Okay. I was asking about acetabular fracture and head of femur fracture. Are they intra? Obviously. यहाँ तक तो capsule है ही ना. This is all the capsular area. So whatever is here, acetabulum is not a part of the femur. तो उसको आप intra extracapsular नहीं बोलते. Capsule area is only limited to the subcapital transcervical region, right? That is only limited to the subcapital or transcervical region. Okay. Is this fine? Cannulated cancellous screws. Very good. याद रहेगा एक्सटर्नल फिक्सेशन कहाँ करते हैं? नेक ऑफ फीमर में नहीं करते एक्सटर्नल फिक्सेशन. इट इज नॉट डन, राइट? एक्सटर्नल फिक्सेशन इज नॉट अ मैनेजमेंट फॉर नेक फीमर. एक्सटर्नल फिक्सेशन इज ओनली डन व्हेन देयर आर ओपन फ्रैक्चर्स. ओके, व्हेन देयर आर ओपन फ्रैक्चर्स. ओके, चलो एक क्वेश्चन और. व्हाट यू आर गोइंग टू डू हियर? देखो 80 ईयर, नाउ द एज इज 80 ईयर. सेम काइंड ऑफ क्वेश्चन, राइट? नाउ दे आर सेइंग इट इज 80-year-old patient, women, brought to the emergency department. After slipping in the bathroom, she complains of left hip pain and is unable to bear weight. She has no prior history of OA. पुरानी कोई ओए की हिस्ट्री नहीं है. एग्जामिनेशन रिवील्स अ लेफ्ट लेग इज शॉर्टर एंड एक्सटर्नल रोटेटेड. व्हाट इज द एप्रोप्रिएट मैनेजमेंट? क्या करोगे इसमें? अगेन द सेम क्वेश्चन. पेशेंट इज डिफरेंट, एज इज डिफरेंट, सब कैपिटल फ्रैक्चर आ गया. अब क्या करोगे? हेमी. व्हाई हेमी? व्हाई नॉट टोटल? व्हाई नॉट टोटल? हेमी क्यों करना चाहते हो आप इसमें? हेमी arthroplasty is to be done. Why? Now hemi. Why? Because the question is telling you what? There is no history of OA. Osteoarthritis nahi hai, right? If there would have been OA changes here, if there would have been OA changes here in the hip joint, तब क्या करते? तब हम age is 80. Yes, you are right. So any age more than 65 years, I hope everybody remembers the treatment plan for fracture neck femur. So any patient more than 65 years, what we are supposed to do? Any patient more than 65 years of age, what we are supposed to do? We have to replace, right? And if it is only the neck femur without arthritis, it has to be hemi. Total in already diseased. Very good, right? Very true. Okay. So I hope this is now fine with everyone. Very nice. ये बताओ, what is the most likely diagnosis in this MRI? इसमें क्या लग रहा है? Options छोड़ दो. Forget about the options. Tell me the diagnosis. Diagnosis. There is a 35-year-old pregnant female who is having pain and all these things. They're asking you for the diagnosis, right? इस पे बताओ क्या करोगे? What is the diagnosis here? What is the diagnosis in this case? Diagnosis for this particular case, right? Diagnosis for this particular case. What you are supposed to do? Can you tell me this? It is disc prolapse, right? You all can see the disc getting out here. You all can see the disc getting out here. Okay. So this is disc prolapse only, right? This is disc prolapse only. राइट. ओके. सो डिस्क प्रोलैप्स है, ये तो आप पहचान ही लोगे. अच्छा चलो मुझे क्वेश्चन का आंसर बताओ. टेल मी द आंसर फॉर दिस क्वेश्चन. इफ देयर इज L5 एंड S1 डिस्क प्रोलैप्स, राइट, मोस्ट commonest nerve to get involved, most commonest nerve root, I should write it, nerve root to get involved, right? Most commonest nerve root to get involved between L5 S1, between L3 L4, between L4 L5, बताओ कौन सी nerve होगी? Most commonest nerve to get involved between, most commonest nerve to get involved between the L5S1, L3L4 or L4L5. What do you say? S1 lower one, इसमें S1. Very good. L3L4 में, L3L4 में, then it is which one? L3L4 second ones. It has to be L4. L4 L5 में L5. Very good. What kind of disc prolapse is most commonest? What kind of disc prolapse is most commonest? It is para central, right? Next to the center. Very good, right? You all are right. इसको भूलना नहीं. This is very very important, especially for your INSET exam. और INSET exam के अंदर जो है, it is being asked in different manners, right? तो इसको मिस नहीं करना है. Okay, इसको मिस बिल्कुल भी नहीं करना. Okay, very good. चलो, do good. I am happy that you are recalling these things very very quickly. इसका आंसर बताओ. What is the answer for this? A 40-year-old man sustained a fracture of the right tibia in RTA. Distal pulses are intact. The wound is heavily contaminated and appears as shown below. So this is your injury. You can see the bone outside the skin, right? The bone is already outside the skin. Okay. According to GA classification, which type of injury is this? What type of fracture does this represent? What do you say? What type of fracture does it represent? 3B. 3B, not 3C. Not 3C. 3 तो है. 3B or C. Why not C? Why not C? 3C में क्या होता है? Periosteal stripping as pulses are intact. Very good. Distal pulses are intact. So that means distal pulses are intact. That is type 3C. अगर pulse नहीं होती तो open fracture is very good. The classification to be used is Gustello-Anderson classification. Very nice, right? So distal pulses will be intact. Very good. Broken bone, muscle flap, 3C, blood vessel involved, pulselessness. Very good. Very good. You are right. What kind of fracture is this? What kind of fracture is this? ये क्या है? If you can make out, the first metacarpal, right? First metacarpal. What do you say? First metacarpal. So there is a fracture over here of the first metacarpal. One fragment is this and one fragment is this. What kind of injury is this? What kind of injury is this? This is the partial intra-articular fracture. What is that called as? Bennett. Very good. This is Bennett fracture, right? This is Bennett fracture. Very good. Okay, this is Bennett fracture. Very good. Why not type 3C? Basically, beta, इसमें देखो ना, distal pulses intact हैं. If the distal pulse is intact, it has to be type 3C only, right? It has to be type 3C only. Okay, right. Very good. चलो. ये कौन सा फ्रैक्चर है? Older patient falling in the washroom, in the bathroom, and there is an injury. What kind of injury is this? Due to pull of abductor pollicis. अरे wow, very good, very good. I'm so happy. Due to pull of abductor pollicis longus, APL. अच्छा चलो, अब यहाँ तक बता ही दिया है तो ये भी बताओ कि APL की नर्व सप्लाई क्या होती है? What is a nerve supply for abductor pollicis longus? What is a nerve supply for abductor pollicis longus? ये भी बताओ फिर, right? What is a nerve supply for abductor pollicis longus? ये भी आपके एग्जाम का क्वेश्चन आता है, right? That is again a question for your exams. Abductor pollicis longus. What do you say? Nerve supply, nerve supply. It has, oh, ulnar. गलत. Median, ये भी गलत. कौन सा बचा? Radial, right? So it has to be radial nerve. Okay, यही तो trick था. Abductor pollicis longus, radial nerve, right? And thumb में देखो, thumb की पूरी supply is by median nerve, right? But there are two exceptions. One is adductor pollicis. When you bring the thumb close, adductor pollicis, which is supplied by ulnar nerve. Okay, and then you have abductor pollicis longus, which is supplied by radial nerve. These two are the MCQs for your exams. Okay, median भी नहीं है, ulnar भी नहीं है, it is radial nerve, right? It is a radial nerve. Okay, understood this? Very good. चलो, याद रखना, इसको मिस नहीं करना. हाँ, you have diagnosed this well. It is intertrochanteric fracture. You have diagnosed this very, very well. Very correct. Very correct, yeah, right? चलो, this is IT. Very nice. Examine the image below. Which clinical test is being demonstrated? Which clinical test? किस condition के लिए कर रहे हो आप? The lady is bending down, and once she is bending down, you can see the left margin of the shoulder, the right margin of the shoulder, they are not at the same level. They are little up and down, right? Why are we doing this test? Is this Adams? Is this Schauber's? Is this Trendelenburg? Is this Enville? कौन सा है इसमें से? And why are we doing it? Why are we doing it? Scoliosis. Very good. It is for scoliosis. What test is this? Adams, right? और ये Schauber's किसके लिए करते हैं? Why are we doing Schauber's? Why this Schauber's is being done? It is done for checking the stiffness. It is done for checking the stiffness at the lumbar region, right? For what condition? Lumbar spine. It is for ankylosing spondylitis, right? That is for ankylosing spondylitis. Very good. Scoliosis. Okay. You can see the scapular discrepancy as well on the back, right? And that is all happening because of distorted kind of spine over here, right? That is scoliosis. Very good. Very good. Ankylosing spondylitis, postural or structural, postural and structure. Very nice. Very good. So this is Adams test. Very good. चलो, इसका बताओ. What is the recommended approach in this case? 24-year-old patient was brought to emergency. Examination has got some deformity, and this is a fracture of the shaft of femur, right? Fracture of the shaft of femur. Tell me the implant of choice for this. Implant of choice for fracture shaft of femur. Or let's say the fracture shaft of tibia. Or let's say the fracture shaft of tibia. Femur or tibia. What is the implant of choice? It has to be intramedullary nail, right? Now, आपके एग्जाम में यूजुअली शाफ्ट ऑफ फीमर, शाफ्ट ऑफ टिबिया के लिए दे डोंट आस्क यू like yeah, the implant of choice, right? They most often ask you the complication that can happen because of this, the fracture shaft of tibia or the femur, and the complication that we usually see is fat embolism, right? It is fat embolism syndrome. Okay, so can you tell me, for the fat embolism syndrome, what is the usual time period in which we can see the fat embolus? Can you tell me during what time period, how much time does it take for the fat emboli to get into the circulation? How much time does it get into the fat? It is Gertz criteria. Basically, it is Gertz criteria, right? Gertz criteria में कितने parameters होते हैं? Gertz criteria में कितने parameters होते हैं? It is 24 to 72 hours. Very good. कितने criterias हैं Gertz के अंदर? How many are the major criterias? There are four major criterias, right? First to the third day. Very good. Okay. So it is four major. The pressure of oxygen going less than 60. Then it is petechiae, right? Then it is respiratory involvement or there is CNS involvement, right? So any one of the four, you find any one of the four. Nahi beta Tanya, it Tanmay. It is different in different literature, right? लेकिन आपकी clinical practice में you find any one of them, you consider your patient going towards the fat emboli, right? You consider the patient going towards fat emboli. Very good. A cyclist fell down, fall on outstretched hand. What is the most probable injury? Right? That is very simple thing. Is scaphoid fracture may you tell me please, in the scaphoid fracture, what is the usual site of tenderness? What is the most commonest site of tenderness? What do you say? What is the most commonest site of tenderness? कहाँ पे होता है tenderness सबसे ज़्यादा इसमें? When there is an injury to the scaphoid, what is the most commonest site of tenderness? What do you say? Most common site of tenderness is the anatomical snuff box, right? Most commonest site of tenderness, it is the anatomical snuff box, right? Most commonest site of tenderness is anatomical snuff box. Absolutely, right? It is anatomical snuff box, right? Now, now, okay, so, okay, right. So most commonest site of tenderness has to be anatomical snub box. Very true. याद रखना scaphoid is oh sorry, scaphoid is a very very important MCQ, right? Yeah, scaphoid is a very important MCQ. And what kind of plaster is given in the scaphoid? What kind of plaster is usually given in scaphoid? Can you mention that? What is the kind of plaster? Why not DAR in this case? Why not DAR? See, whenever you are talking about the fallen outstretched hand, most commonest injury to happen, most commonest injury to happen, probable injury. It can be distal radius also. That is never point out of doubt. But if they would have to ask you the distal radius fracture, it will always be evitable. It will always be visible to you, right? And then they always have to mention some sort of deformity. When there is no deformity mentioned and there is only complaint of pain, the wrist pain, only pain, then it comes in favor of scaphoid, right? Deformity plus pain, it comes in favor of distal end of radius. But without deformity, it is only pain, then it goes more in favor of scaphoid, right? You are not wrong in thinking about distal radius. Overall, the most commonest fracture to be seen, it is distal radius, right? Most commonest fracture to be seen is distal radius, but always remember, it is the deformity plus pain which will be seen. But in scaphoid, it is only and only tenderness, right? Very good. Glass holding cast. It is the glass holding cast. And very good. If implant has to be used, it has to be Herbert screw. Very true, right? It has to be Herbert screw. Okay, so this is the Herbert screw we have. Very good. All right. Okay. Okay, so 20-year-old male is having pain and a feeling of instability after twisting the knee. Instability has to be a feature of injury to what component? What structure do you think is damaged? If it is instability, what structure is damaged? What do you say? What structure is damaged? Instability. So stability of the knee is maintained by stability of the knee is maintained by the ACL. Very good. The cruciate ligaments, right? And out of the two cruciates, which is more commonly injured, it is ACL more than PCL. Very true, right? It is a ligamentous injury, the cruciate ligamentous injury. Okay. Now, if they say there is complaint of locking of the knee, then what is the trouble? If they say there is complaint of locking of the knee, then what is the trouble? What do you say? Patella, instability, right? Twisting, say patella fracture. No, patella fracture doesn't happen with twisting. Patella fracture happens with sudden violent contraction of the quadriceps. When there is somebody falling down with sudden, sudden flexion of the knee. So quadriceps pulling the two poles of patella in opposite part, right? So locking of knee, agar kisi ka complaint hai, then what is the challenge? Patella? No. Then it has to be menisci, right? Locking of the knee is the complaint of injury after menisci. Okay, very good. ये छोटे छोटे पॉइंट्स है बच्चों, डोंट मिस दिस आउट, इट इज वेरी मच रिक्वायर्ड. सो ACL, right? The MCL is always about the lateral instability, right? Mediolateral instability, we should say. Mediolateral instability. Menisci is about locking, right? Menisci is about locking. Patella is by distraction forces. Very true, right? 50-year-old women presenting with the hip pain following a fall, and the X-ray reveals fracture of the femoral neck. Oh, we have discussed this kind of thing. Fracture neck of femur, you all know. Whenever you're talking about fracture femoral neck, then we never talk about a conservative management, right? Because these are the fractures of necessities. There are certain fractures which always requires fixation. Which ones? Number one, the fracture of lateral condylohumerus. Fracture of lateral condylohumerus. Second, which one? The fracture Galeazzi, right? And then we have fracture neck of femur. These all three have to be always operated, right? Cannulated screw, necessity, neck of femur, always surgical. Yes, you are right, Shalu. Okay. She sings. Okay. Wow, creative names. Very good. These are fracture of necessities. सारे Montegia नहीं होते बेटा. सारे Montegia are not the fracture of necessities. It is only the classical Montegia. राइट बाकी सब जितने भी होते हैं, ये तीन तो 100% केसेस में है फ्रैक्चर ऑफ नेसेसिटी, राइट? सारे पटेला को ऑपरेट की जरूरत नहीं पड़ती है. कौन से पटेला को ऑपरेट की जरूरत पड़ती है? व्हेन इट इज टू पार्ट पटेला, व्हेन इट इज टू पार्ट पटेला विच इज डिस्प्लेस्ड, राइट? टू पार्ट पटेला विच इज डिस्प्लेस्ड. ओके, इफ देयर वाज अ ऑप्शन ऑफ CRIF इन द ऑप्शन, CRIF क्यों देते? CRIF पे तो फिक्सेशन है ना. Neck of femur can be operated in both the ways, CRIF or IF, depending upon what kind of injury it is. If it is intracapsular, it has to be CRIF. If it is extracapsular, it has to be ORIF, right? Montegia is a necessity with a condition. What is a condition? Sorry. What is a condition? That it has to be a classical one, right? Chalo, good. 60-year-old women complain of pain and shows a dinner fork. Kahan milta dinner fork? It is a simple, straightforward question. Simple. Dinner fork is Coley's. What kind of deformity do we see in Smith? What kind of deformity do we see in Smith? Coley's has dinner fork, which is true. Coley's has dinner fork, which is true. What about Smith? What about Smith? What kind of deformity do we see here in Smith? It is garden spade deformity, right? It is a garden spade deformity. Yes, it is Coley's. True. You are right. It is Coley's fracture. Garden spade. Very good. Very true. ये क्वेश्चन जो है नेक फीमर के आसपास बहुत सारे आ गए. अब 70-year-old लेडी है, एज इज 70 एंड शी इज हैविंग ऑस्टियोआर्थराइटिस ऑफ द हिप. अब क्या करोगे? लाइक यू टोल्ड मी ऑलरेडी, when there is OA, it has to be total, right? We have already discussed. So always remember the first question to be discussed in the fracture of neck of femur, in the patients of fracture neck of femur, is age, right? It is age. When it is more than 65, it always is hemi. If there is arthritis, it has to be THR. If it is arthritis, it has to be THR. Very true, right? Very good. Less than 65, no replacement. Save the original head, right? It has to be save the original head. Okay, very good. Very true. A child, 9 years, got run over by a car, was admitted. Patient was having swelling and deformity of the left thigh. X-ray shows a fracture of shaft of femur. Preferred treatment, 9-year-old child. What to do? It is femur fracture. Any child at 9 years of age, how it is to be treated? What do you say? What do you say? Any child at 9, how it is supposed to be treated? What do you say? It has to be surgery, right? Any child more than 5 years, any child fractures shaft of femur. When you talk about shaft of femur, how it is to be managed? Any child less than 2, we can go for gallows, right? Traction system. Any child less than 5, we can go for hip spica, right? And any child more than 5 to 10 years, what is to be done? It is, what is the difference in option B and C? I'll tell you. In 5 to 10, we go for elastic nails, right? It is elastic nails. And when it is more than 10 years, it has to be locking nails, right? What is the difference in locking nail and elastic nail? Let me show you something. Let me see if I can figure out the PPT. Let me just see. Give me a moment. Yeah. So I'll show you what is the difference in these two. Dekho, when you say locking nail, these are locking nails, right? Locking nail का मतलब क्या होता है? When you put a nail inside, when you're putting a nail inside, and after putting the nail, you put the screw to lock it. These are called as locking screws or the locking nails basically, right? This is used in adult bones when the bones are stronger. But when you have pediatric age group patients, उनमें bones soft होती हैं. So you can't use these rigid nails, hard nails. So what we do? We use these kind of flexible nails. And what are they called as? Elastic nails made up of titanium. And that is why these nails are called as what? These nails are called as titanium nails, TENS, titanium elastic nailing system, right? This is the difference in the locking nail and the TENS nail. So it is titanium elastic nailing system. Titanium elastic nailing system, right? Titanium elastic nailing system. Okay, difference समझ में आया दोनों को? ये दोनों के बीच में AIMS E3T, right? Okay, I hope it is fine. Okay, चलो, ये वाला इंजरी क्या है? What you all can see, RTA patient coming to you with injury to the cervical spine, right? And having a cervical spine burst fracture of the atlas. See, you all can see the fracture line. Okay, you all can see the fracture line over here. क्या बोलते हैं इस fracture को? What is this fracture called as? Fracture of the atlas. What is that called as? J. What is this? Jefferson fracture, right? अब ये totally undisplaced है, okay? So for undisplaced fracture, what you're supposed to do? Fracture of the atlas, very true, it is Jefferson. So what are we supposed to do for any of these undisplaced injury? It has to be conserved, right? Rigid cervical collar. Had it been a displaced one, then we would have gone for atlantoaxial fixation or fusion, right? Had it been compressing upon the neural structure, we would have gone for anterior decompression, right? So whenever it is undisplaced, it simply needs a conservative management and stability. Like I always say, we are nobody to fix the bones, right? The healing of the bone is not my job. Healing of the bone is done by nature. And what we do is only to keep them in position. So if it is an undisplaced fracture, it is already into position, right? So you have to just know, not surgical beta, surgical कब करते हैं? When the bone is displaced or it is producing any neurovascular compromise, right? Else it has to be conserved only, right? So bones are the most fantastic tissue we have. They heal up nicely provided you keep them together. Okay, chalo. Now this one, he complains again, a patient falling, complain of the wrist pain, swelling and limited motion. Again, no mention of deformity, right? On examination, there is tenderness in the anatomical snub box, right? Which of the following is the most likely diagnosis? That is scaphoid. Now you tell me one thing, I'll put a add-on line to it. Somebody comes to you, tenderness in the snub box, and the person on duty, the doctor on duty has got an X-ray done, right? And X-ray is not showing any fracture. X-ray is not showing any fracture. What do you say? What is the next step in the management? If X-ray is not showing you any fracture, what is the next step in the management? What you are going to do? What you will do? What should be the next step in the management? What do you say? Cast. Very good. So it has to be treatment. Treatment has to be the cast, right? No need to put X-ray. May not show fracture up to how long? Up to 2 weeks, right? X-ray may not be showing you the fracture for up to 2 weeks, right? So these are some of the important MCQs we have, right? And maybe tomorrow again, we can meet again and we can discuss some of the MCQs, right? So meanwhile, you have done some mistakes. Some of you have done some mistakes. Number one, you have missed, some of you have missed the treatment plan when it is about the fracture neck of the femur, right? Very, very important topic. Some of you have missed some of the component of the Colles, राइट सम ऑफ यू हैव मिस्ड व्हाई नॉट एमआरआई बेटा एमआरआई तो करना ही नहीं है अभी उससे कोई एडवांटेज नहीं है ना एमआरआई इज ओनली गोइंग टू शो यू द मारो एडिमा और मे बी द एवास्कुलर नेक्रोसिस लेकिन एवियन इमीडिएटली होगा नहीं है ना एवियन इज गोइंग टू टेक सम टाइम मे बी अ वीक मे बी 2 वीक्स राइट और अगर एवियन के अलावा आपको फ्रैक्चर चेक करना है तो यू कैन गो फॉर सीटी स्कैन सीटी विल बी शोइंग यू फ्रैक्चर्स बट अगेन द पॉइंट इज कि फ्रैक्चर होगा और सीटी करा भी लोगे तो भी नेक्स्ट स्टेप इज नॉट गोइंग टू चेंज. That is why in scaphoid it is usually recommended that if you suspect an injury, put a plaster, wait for 2 weeks and repeat an X-ray again. Right? So I hope you understood this point. Question number 2. ये वाला ये तो mobility पे ही है ना बेटा. This is all about the mobility, कि how the distal fragment is going to move. So abductors are connected over here. So when abductors are here, these abductors are here, they are going to pull it up. They are going to pull it on the outer side. Right? So 7th 1 2 3 4 5 6 7 ये वाला इसमें क्या नहीं समझ में आया बेटा प्लीज बताओ जय. देखो पल्सेस palpable है ना if pulse is palpable it means it is 3B. bone is exposed bone is exposed and the pulses are palpable. So if the pulses are palpable then definitely it will not be type 3C. right? Bennett versus Rolando. Bennett जो होता है we have seen this injury कहाँ गया ये वाला. देखो बेनेट के अंदर यू विल ओनली सी 2 फ्रेगमेंट्स फ्रेगमेंट 1 एंड फ्रेगमेंट 2 बट had it been Rolando वो फ्रैक्चर लाइन ऐसे आता है so you'll have been able to see 1 fragment 2 fragment and 3 fragment right or maybe a fracture line like this so again big fragment 1 and 2 and 3 so when it is comminuted intraarticular it becomes Rolando when it is only 2 pieces of the bone 1 fracture line it is called as Bennett. Okay, so trauma is the biggest section in orthopedics, I can say, right? If you are getting some 10 questions in orthopedics, around 5 or 6 comes usually from trauma itself. Because trauma में nerve injury साथ में आ जाती हैं. And then the presentation of patient, fracture of necessity is important. Concepts are too many actually here, right? So these are few MCQs. I'll see that if I can take some of the other MCQs tomorrow as well. And keep on revising orthopedics very nicely. And I'm telling you, try not to mug up anything. Have some concepts. And once you develop concept, things become easier for you. राइट तो जिसने आज क्वेश्चंस को गलत किया गलत आंसर किया अभी प्लीज मेक श्योर दैट यू नो यू रिव्यू देम फ्रॉम योर वर्कबुक फ्रॉम योर नोट्स दोबारा से देखो एंड इफ देयर इज एनी अदर चैलेंज यू कैन जस्ट कनेक्ट विद मी ऑन द टेलीग्राम ग्रुप और इंस्टाग्राम वेयर एवर यू आर कंफर्टेबल ड्रॉप मी मैसेज एंड आई विल ट्राई टू रिवर्ट बैक एज सून एज पॉसिबल राइट सो let's hope we meet tomorrow again with some new set of questions. Until then, revise, review them very, very thoroughly and conceptually. Stick to the concepts and that is very, very much required, right? Stick to the concept. Okay, chalo, it was wonderful being with you and you all have answered very nicely, but जो गलत किया उसको ठीक जरूर करना. Okay, chalo guys, thank you so much and keep studying, stay hopeful, stay positive and see you all again tomorrow. So review your topics very, very nicely. All right, thank you so much everyone.